so we have our cassette here. We want to identify how to place it into the holder. We have the yellow surface here which has an arrow that says this side up. So obviously we want this to be facing up. And the other side has a note on it that says tube side. So we want this side to be facing the tube. The tube on this pan machine is located in this area. So we will place it into the holder with this arrow facing up and the tube side towards the tube. And we lock it in there. Great. So now we've set up the machine. We could turn on the power, and that power switch is underneath here. We switch it on and we give it a minute to activate. Once you hear a beep, then you could actually set the required settings. So to review the settings here, we have the first area on top they're asking us what type of image we want. We will be using the number 1 being adult and number 2 being a child. We use these 4 arrows on the lower end of the panel to control our settings. So we're going to be using an adult size, and I just arrow down, select automatic, manual, or test. For our patient requirements, we use the manual. And if ever we're testing or practicing on a peer, we will be using the test mode. This test mode will activate the machine but will not use any radiation. So for today's purposes, we'll start on the manual. We can see the KVP and the MA are set. We want to note that the numbers here, we will be required to identify those numbers and document them in our services rendered. And then the lower area here is the size of the patient. So there's 4 sizes. The first one would be a child. The second one would be a teenager. The third one is average adult, and the fourth one being large adult. Okay, so now we've selected our settings. To review the panel, the buttons here on the side panel, these arrows will move the machine up and down. The top row here, the first 3, those are our occlusion settings. So we'll go over that when positioning a patient. We need to tell this machine the occlusion of our patient. And then these 2 arrows, this will raise and lower our actual panel. So if you need to raise it for positioning and then lower it when you're about to expose, you just use those ones. And then finally, the lower 2 here is our light. So if we do need to reset our light, we'll hit the light button, and this is a reset button. Okay, so we have our machine all set up, ready to go. Now it's time to invite our patient into the area. Hi there, how are you?
Hi, good, thank you. Yourself?
Great. So Dr. Sate asked me to take a pan for you today.
Okay.
So have you had a pan before?
No, I have not.
Okay, so I'm going to tell you a little bit about it before we begin, so you have an idea of what's going on and why we take them. A pan will show an image that is a round on the outside of your head. Okay, we call it extraoral. The bite wings that we just previously took to you is an intraoral exposure. This is an extraoral, so it's outside the patient's...
Outside the mouth?
Exactly.
Okay.
What it's going to show is all of our teeth. We're going to have our crowns of our teeth, our roots of our teeth. We're going to show all bones supporting our teeth, our jawbone, and our joint. We use it for diagnostic purposes, looking for any abnormalities, and also as a baseline for any younger patients. We can see our wisdom teeth and everything in action, so it's very useful.
Okay, sure. How often do I take this?
This can be determined, it's individually based. There's no required that every patient requires one every year or every 5 years, but on average it's about 3 to 5 years.
Okay.
Okay, do you have any questions?
No.
Okay, so before we begin, I'm going to have you remove any jewelry that you may have from your shoulders up, or any metal hair ties.
I'm good.
Okay, and do you have any removable appliances or dentures?
No, I do have like a metal wire at the bottom of my teeth and top and bottom. Is that okay? I can't take that.
Yeah, well, it'll show up on the image, but we can't remove it, so it's okay where it is. Excellent. Okay. So before, I'm just going to have you stand over here. I'm going to place a lead apron on you. Just be prepared. This apron is quite heavy, so brace yourself. I'm going to place it on. Is that okay?
Sure.
And I'm going to attach it at the back here. So for our patients, we want to have it attached and closed with the Velcro here and evenly on the shoulders. We really want to avoid having it too high on the back of the neck here because that could impact the quality of our image. So I'm going to place it here and attach it. Are you okay there?
I'm good, thank you.
Excellent. At this point I'm going to place my PPE. What's required during a pan exposure would be gloves and safety glasses and a mask are optional. Okay, so I'm going to explain the procedure or what to expect before we begin so you have an idea. Okay, so I'm going to put one of the positioning sticks in and this is the little plastic piece that I'll have you bite on, okay? It's disposable, so I'm opening up a new one for you. And I'm just going to place it here. So what you can expect, I'm going to have you hold on to these handles, okay? And then you'll be resting your chin on this black platform, and then you'll be biting on this bite stick right in this groove with your two front teeth. Okay? I'll help you and guide you through it. I'm going to raise it up for you a little bit here. There you go. Okay, so are you okay? You can come in and hold onto the handles. You can place your hands here to support you.
Okay.
And you can come forward. And I'm going to get you to see that little groove there. You could bite on that for me. So you can help bring in and support your patient and guide them to the stick. Very good. So a little bit closer. Yep. Two front teeth groove. Great. Excellent. So it seems a little high. You can see our patient's chin is quite high. So we're going to lower the machine a little bit for their comfort and obviously for our positioning. So if I'm lowering, you can see, now you can see the patient's chin is a little too low. So I'm going to raise it just for comfort, and then we'll position her exactly how we would like. At this point, I'm going to ask the patient to stand very tall. So you can stand as tall as possible. I really want you to stand straight. And I always support the back of the patient's head, giving them a little bit of a pressure up so they know to stand tall. If you think, you can imagine a thread coming from the back of the patient's neck and pulling them up high here so we could elongate the torso and the spine. At this point, I'm going to have the patient step forward again to help with the spine, stretching it out a bit, and keeping the patient really standing tall. Great, good job. So now we're going to look at the profile of the patient's face. We want this to be perpendicular to the floor. So again, for an example, if it was too high, you could see, whoop, that happens. And you could see Fareen's face is at an angle tipped back. And if it's too low, you can see that she's at this angle. So we want it right straight, perpendicular to the floor. The next line we're going to look at is the Frankfurt horizontal plane. We use this adjustment here to help us as a guide. We want it to be going right through the tragus of the ear and following the bone, the cheekbone there. And we want that to be parallel, lining up with our patient's Frankfurt horizontal line. So that looks good here for Fareen. The third line is the mid-sagittal light there. We're going to ask our patient to look into the mirror and ask them to position that line right through the center of their face. Okay, so if you can look in the mirror and try to line up that line in the middle of your face right through the center as evenly as possible. That looks good. Are you doing okay?
Mm-hmm.
Okay, so at this point I can see here, Fareen's chin is just slightly tipped up. So we're going to give her one little down, and now I feel more comfortable that it's more perpendicular. So now I'm going to offer her some support by using the calipers and the head support. You do that by squeezing these little white little dots, and you bring it in forward, lining up to her forehead. And then you're going to tighten the calipers. So again, just offering support because we want the patient to be as still as possible through this exposure. Okay, So continuing to be on midline, keeping everything in the center there, that looks good. I see that she's set up profiles straight and her horizontal line is parallel to the floor. She's standing as tall as possible, which is great. Now I'm going to ask the patient to smile, keeping her teeth closed onto the bite block. What I'm looking for, I'm looking at her canine, her 3 there. I'm looking to see where that light lines up. This is her occlusion light. We want to see if it's mesial of the 3, right on the 3, or in the distal of the 3. And that is when we're going to be telling the machine where the light lines up. So looking at Farine here, I could see it's mesial of the 3. So I'm going to select the mesial button. So just as a review, here we have the mesial of the 3. This one is right on the 3, and this is distal of the 3. That's perfect. So now I'm going to ask the patient to close her lips around this bite block, swallow, and raise your tongue to the roof of your mouth and hold it there. The machine is going to rotate around you. It takes about 30 to 40 seconds. You may want to close your eyes because you can have a tendency, people have a tendency of following the machine, which would alter your positioning. So if you could close your eyes and just relax, just hold as still as possible. And you'll hear it'll take about 30 to 40 seconds. Are you okay?
Mm-hmm.
Great. So tongue to the roof of your mouth, close your lips. Mm-hmm. Excellent. So this cassette is going to come down right beside your shoulder here. Don't be alarmed, it's not going to touch you. And you'll hear the machine moving around you. It'll make a little bit of a noise, and when it's done, I'll instruct you when you can move. Okay? Good job. So we're going to come out to the exposure button. But for this purpose, obviously we would want to have it on test, such that Farine gets no radiation today. And we're going to firmly press our exposure button. We'll hold it down the entire time as the tube head rotates around the patient's head. You're doing really well. Keep holding still. We're almost finished. Great. So now that it'll stop, and we hold it for 1, 2, 3 seconds, and then we release the exposure button. At this point, we can come in and help our patient. We're going to loosen the calipers and instruct the patient to back out slowly. Excellent. I will then remove the white bite block and remove my gloves before I touch the apron. How did that go for you, okay?
Oh, good.
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 You did very well.
Thank you.
So I'm just going to get you to turn around so I can remove this. There you go. Thank you.
Thank you.
Hang this back up. Do you have any questions about that, Farine?
No. Do I see the image produced right away?
I have to process it, so it'll take about 10 minutes, okay? So I'm going to walk you back to your operatory.
Sure thing.
And then if you need a magazine or a drink water, let me know, and I'll be back in about 10 minutes, okay?
Sounds good.
Okay, thanks very much.
Thank you.
Okay, to remove our cassette, we're going to remove our cassette and we'll take it to the processing area.